Hello, Dr. Ben Galyardt here, and I want to share with you some of the amazing things that we're able to do when we start training the brain to do something different. There's many different conditions that we're able to help when we start thinking about teaching the brain to do something different. So when you're dealing with ADD, ADHD, autism, brain injuries, so traumatic brain injury, head injury, concussions, any PTSD, any anxiety, depression, insomnia, any of these ranges where the brain is going way past where it should be, we're able to teach that brain to do something different. The primary tool in this process is what's called neurofeedback. Neurofeedback has been around for decades, since the 1970s. It's a operant conditioning protocol where we're able to teach the brain something different. Just like learning how to ride a bike, we're able to learn a new skill. So the traditional pattern that we see with ADD is hard time staying in that focus state, easy falling out of the focus state and going into a daydreaming state. So daydreaming high and we've got our focus low. We can train the brain to do the opposite of that. So every time it goes to that wrong range, whether that's insomnia, whether that's that focus issue, whether that's an anxiety or someone's having a panic attack, it's all well and good to try to learn these new skills and go, oh, I'm going to do a calming technique, or I'm going to do some deep breathing. Any of those things can be effective, but if your brain waves are way out of where they're supposed to be, it doesn't matter. We're not going to be able to see those changes that we want when you're doing it on that conscious level. So we've got to do this on a subconscious level. The great part about that is we're able to figure out these imbalances from what's called a brain map. The brain map is our way that we're able to see where those deficiencies are, either too high or too low. Have there been areas of damage? What do we need to do to teach that brain something different? And can we regenerate and rebuild this tissue? The research shows that after doing neurofeedback therapy, we get more white and gray matter, which is the important nutrient side of the neurons. Those are starting to rebuild. We also increase our ACT score by 2 points. Studies show 5 to 15 points, depending which one you're looking at, of an increase in IQ. So we get some phenomenal changes in that brain. We get some improvement to the point where people can go back to college that were never able to go because their panic attacks were so high. They're able to focus. They're able to sleep through the night. Within the first 5 or 10 sessions, they're seeing these phenomenal changes. So the first step is we need to get that brain map done, and we can tell, is this the type of brain that we're going to be able to help? All these conditions we've talked about are fixable. We can make these changes and we can get permanency. You don't have to be on a medication, a supplement, keep doing brain training the rest of your life. We can make these changes. The vast majority of our patients, we don't need to see them again. We'll remap on an annual basis to make sure nothing is sliding back. But for the vast majority of people, we make the changes and they see permanent results. So I look forward to meeting you in person, and we can do that consultation or a brain map and get you going with the process.